I'm a registered clinical psychologist and also a registered neuropsychologist, and I've been in practice for 27 years, and I've been in full-time medical legal practice for 21 years. I've been asked to say something about what we neuropsychologists do in the medical legal context and about what's currently on my mind that I feel motivated by. So let me start by saying that those of us who have a double registration, that means a registration in clinical psychology and a second registration in neuropsychology, we're in a unique position. We have a vantage point in medical legal assessments, and that's because we evaluate two sets of variables. Firstly, those aspects that follow from the accident and from its effects that are particular to clinical psychology. For example, levels of depression, post-traumatic anxiety, generalized anxiety, substance abuse, all these that arise due to chronic pain or psychological traumatization. The second set of variables that we evaluate are those aspects that are more specific to neuropsychology, in particular the effects of brain damage or brain dysfunction on the patient's cognitive, behavioral and interpersonal functioning. Now this dual focus, this double focus, is especially useful in the medical legal context because we're very often asked to determine whether the patient's deficits and problems are due to psychological factors or are they instead due to organic factors. In other words, a brain injury or a combination of both, and if so, if it is a combination, then in what proportion. Another point to consider is this. It's important to know that in patients with significant depression, anxiety, and patients with chronic pain, we often see problems arising in cognitive functioning. This is without any brain damage or dysfunction, and it's due to the impact of mood disturbance, pain effects on a person's concentration, on their memory, planning, organization, processing speed, and so on. And these cognitive problems will show up in careful neuropsychological evaluation, and these cognitive changes can result in deterioration in a patient's workplace functioning, especially in work positions that require clerical or administrative skills, and especially when you add the depression and the anxiety to the mix. So if one is interested in tracing the broad effects of an accident on a patient's quality of life and on their academic and vocational functioning, so then it's important to evaluate their cognitive functions whenever significant depression and pain effects are present. And this is even in the absence of a traumatic brain injury. Something I feel strongly about, which I think more people in the medical legal field should be aware of, is the following. For many years, the practice of neuropsychology in South Africa was not formalized in terms of registration with the Health Professions Council of South Africa. And any psychologist could technically practice neuropsychology, and it was left to peer credentialing organizations like SACNA, the South African Clinical Neuropsychological Association, to provide specialized training for those who were interested in providing quality of service. Now, in the last 2 years, though, this has changed, and the Health Professions Council, through the Professional Board for Psychology, now has a formal register in place. There's a formal registration process, and the register's begun to be populated through a careful selection process. I've been fortunate to be involved with that process with the professional board. Many attorneys are not aware of this change, and in my opinion, to be considered as an expert witness in neuropsychology, one should at the very least be registered as a neuropsychologist with the Health Professions Council of South Africa. I think in the current confusing circumstances with the pandemic and with the flux going on within the Road Accident Fund and the change of procedures relating to trials and so on, So it's still important for attorneys to maintain an emphasis on quality of service and assessment. And there's a list of many well-qualified neuropsychologists who are formally registered with the Health Professions Council and who are also trained as full members of SACNA. And I feel that it's important for the development of the profession of neuropsychology and of course for the maintenance of standards in the profession. It's important that this is known, that it's publicized. Now, my experience with Salomé le Roux Attorneys over the past at least 10 years is that this is a firm that does place high value on quality of service. It's precision, detail orientated. I've gotten a strong sense of professionalism balanced with compassion for clients. One thing that's quite unique, at least in my experience, is that this firm makes an effort to connect with the supporting staff, for example, by involving secretaries and office managers in functions like teas. It really creates a bond between the firm and the most important people who constitute the backbone of medico-legal practices like mine, which is the supporting staff and the office managers.